My name is Dr. Joe Garland. I'm in the Department of Medicine in the Division of Infectious Diseases. I work in a number of different clinics in a number of different settings. I think that something that ties them together is that in different ways I'm working with groups on the margins of society, and that's by choice. That's what I'm interested in. I think that we have a lot of health disparities in this country, and I think that one way I am able to help address those is to recognize the advantages that I've been given and to work with patient populations that haven't been given those advantages. Working with other people from Penn who, when I call them up and say I have an uninsured patient who really needs this, needs to be seen by a dermatologist, I have never had anybody say no to me. And that goes across specialties. People have been incredibly willing to give time to, the pharmacy has been willing to donate medications for patients who desperately needed them. Probably one of the favorite things that I have to do is work at the refugee clinic at Penn Center for Primary Care. I think something that's unique about the refugee clinic is it's been such a collaborative effort. We work very closely with a community partner, a resettlement agency called HIAS Pennsylvania. In fact, the clinic started because HIAS approached Penn saying our refugee numbers have doubled in the past 3 years. We don't have enough physicians to see them. Would you be willing to open a clinic to help us? And so we opened the clinic in October 2010, and over the past year I've seen 75 patients. Sometimes when you work with refugees in particular, you see such adversity that they have overcome, and yet you're the first doctor seeing them, and so you see them and you have all of these tests you have to run, and then some of the tests come up positive for something terrible, and then you have to sit down and say, I know you've been through all these terrible things, I know you've just made it to America, but I need to send you to an oncologist. I need to send you to a specialist for something terrible. I think that level of coordination of care for someone who comes from a very culturally different background and who has little ability to advocate for himself in the American healthcare system is really special. And again, it reminds me of how when I see such adversity that I really see the best side of both the patients and of the healthcare providers who are so willing to go the extra mile and make sure that this stuff happens. I play a very small role in that, and I'm always humbled by how it all works because everybody cares.